How to treat a facial burn from a curling iron to prevent scars. A curling iron is a great tool for making your hair look good. But, because it is so close to your face, it can burn you on this very sensitive and exposed part of your body. If you react quickly, and treat the burn properly, you'll reduce the chances of getting a nasty scar as a souvenir. Cleaning the burn. Turn off the curling iron. You'll need to focus on cleaning off the burn right now, and you don't want to worry about the curling iron. Turn it off or unplug it, and set it down somewhere out of the way so you don't accidentally touch it while taking care of yourself. wh.performance.mark, Step 1_rendered. Identify the kind of burn you have. There are 3 kinds of burns you can get on your skin. Each type requires a different kind of treatment, so you'll need to be sure what you have before doing anything else. First-degree burns are the most common and least serious. These are minor burns that you can treat yourself. A first-degree burn will have redness, swelling, and pain. If the burn involves most of your face, though, treat it more seriously and get emergency medical help. Second-degree burns are more serious, and your treatment will depend on the size of the burn. A second-degree burn may have red, white, or splotchy skin, swelling, pain, and blisters. If the burn is 3 inches or smaller, you can treat it like a minor burn. If it is larger, treat like a major burn and get medical help immediately. Third-degree burns are the most serious, and involve burning off all the skin and underlying fat. The area may be charred black or white. If you have a third-degree burn, you may also experience difficulty breathing, carbon monoxide poisoning, or other toxic effects from smoke inhalation. You probably won't get a third-degree burn from a curling iron, but it is something you should be aware of. Cool the burn. Running water is not recommended for any burn, as it can damage the swollen, injured skin and increase blistering, scarring. However, you can hold a cool, clean wet cloth on the burn for 5 minutes to help cool it down. The water should be cool, not cold, so avoid ice or cold water. Water is the best choice for cleaning. Irritants like harsh soap, hydrogen peroxide, iodine, and alcohol will probably only delay healing, making a scar more likely. 3. Cover with a thin layer of aloe vera. Use some pure aloe vera gel to help soothe the wound. Apply a thin layer of the gel to the burn. This will give you some relief and it can also prevent scars from developing. Do not use cream, lotion, oil, cortisone, butter, or egg whites on the burn. Cover the burn with a bandage. A pressure bandage on the burned area will break up the scar tissue and prevent rubbing. This will help to reduce the appearance of scars. Make sure to avoid using a dressing or bandage that sheds fibers, as they can get caught in the burn. If you need the bandage for longer than a day, be sure to change it once a day, or whenever it gets wet. 7. Take pain relievers as you need them. To reduce pain, go ahead and take the recommended dosage of over-the-counter medications like ibuprofen, Advil, Motrinib, naproxen sodium, Aleve, or acetaminophen, Tylenol. This can help prevent you from feeling or itching the burn area, which can help lead to further scarring. If the person who was burned is a child, they can take ibuprofen or acetaminophen for pain relief as well. However, do not give aspirin to individuals under 20 years of age, as it can lead to severe complications. Follow the dosage instructions on the bottle. 9. Children can take naproxen as well, but the usage should be managed by a doctor. 10. Watch for signs of infection. A burn is a wound, and you need to be careful that it doesn't give you a common infection like cellulitis. Cellulitis symptoms include fever and chills, swollen glands or lymph nodes, and a painful red rash. The skin around the rash may blister and scab over. If you notice signs of an infection, go see your doctor for treatment.